Truth on the flu vaccine this morning on our AM Minnesota show. Now, yesterday I told you I was going to try and get a show put together. Isn't this amazing how fate works? To go over to Kenyon, Wanamingo and visit with some math whizzes. They have a team. They finished like third out of 19 teams in southern Minnesota in a recent tournament, this math team. And I thought, we talk about the sports teams and but we don't visit much with the smart kids, the math kids, so we're going to try and put together the show. Well, as fate would have it, Kenyon Wanamingo doesn't have school today, so if I had arranged the show, we probably wouldn't have had it anyway. And we wanted to get somebody in to talk about the flu, and Susan Prieve is with us this morning, and she is from Rice County Public Health Nursing. And Susan, thanks for coming in.
Thank you for having me. Good morning.
I really appreciate your coming in today and being on our show. And she gave me a shot before the program. I didn't even feel it, Susan.
You were very brave. You did just great.
Well, I don't know about brave, but I mean, it's not the first flu shot I've ever had. But I seem to recall as a kid they hurt, but as an adult they don't.
No, you did just great. And children usually do just really well with their vaccines as well. We know how to work with kids to make that as comfortable as possible for both them and their parents.
And anybody who's ever seen me knows I have nothing for arms, so my arms probably aren't much bigger than they were when I was a kid. You know what I'm saying? So adults it wouldn't hurt because there's more muscle mass in an adult than a kid typically, right?
We gauge the needle for smaller children, so it should be comfortable. We try and keep it as comfortable as possible for both.
Yeah. So anyway, I got my flu shot before the show. Now typically I get my flu shot with regularity before this date. It just hasn't worked out for me, and I'm sure you've heard that from a lot of other people too.
Yeah, we talked a little bit about that, and we know we're heading into the peak of the flu season. It takes about 2 weeks after you receive a flu shot for it to become effective. So really a well-timed opportunity to talk to everyone that's listening, to let them know that now is the time to get your flu shot, because we know we're at a high peak time of the season. And we would just love to have you either come see us at Public Health, go see your primary provider, and get that flu shot as soon as possible.
You say it takes 2 weeks to kick in, so to speak.
Correct. Your body isn't going to be able to produce those antibodies for a couple weeks, so it's important to get it now.
How long am I protected
We have to
for?
keep you, for the next 2 weeks, you're still not considered completely protected.
Right, but how long will it cover me? For 6 months, 3 months?
Yeah, we're going to have efficacy then. I'm not sure the total number of months, but from season to season, that wanes, but we're going to have you covered to get you through the rest of the season.
Yeah, what I'm trying to ascertain here is if I got it in October.
Correct. You're still going to be getting through the season. That's why we usually start vaccinating people hard and heavy in October.
Right.
Because we know we're going to get good immunity through the high peak time of the season.
So that tells me about 4 or 5 months?
I don't know the exact amount, but I think you got a good approximate there.
Oh, okay.
And we also know with flu vaccine, as opposed to some of the other vaccines, that immunity then wanes off. And that's why this is a vaccine that you need to have every single year. The strains of flu change and they mutate. And so the CDC and all the people involved in the research with vaccine work to look at all the different patterns of how flu occurs and try and get the best match we possibly can between the strains that we're seeing in our areas and the vaccine that's developed.
So it's a little bit of a guessing game. I mean, there's some research and
there's
the trends.
There's a lot of research, but it's not a perfect science because viruses change and they're a moving target, and we use all the data that we can to try and match as well as we can, but it will not be a perfect science because it changes.
Yeah. That's the bugaboo in the whole thing.
Absolutely.
But it still makes the most sense to get that flu shot, especially if you're in some groups, and we'll talk about that in our next segment. We're going to find out just how effective the flu vaccine was last year. We don't know yet this year, but we're going to talk about last year a little bit in our next segment. So you'll want to stay tuned, folks, and find out more about getting your flu shot. And Sue told me before we hit the airwaves, or Sue, do you prefer Susan over Sue?
Sue's just fine.
Okay. You told me before you hit the airwaves. Well, now I've plumb run out of time. We're going to get that market update. I'll tell you what she told me after the market update. courtesy of your KDHL.
The monitor said even though those really good parts of the field didn't really look that much different from the okay parts.
Yeah, I mean, through the windshield, you
So I ended up
didn't
getting
really
a mobile
pick
home
anything
out
out
in
there.
Blakesburg,
You said, boy, this is really going to ramp
was in a
up or jump
cornfield,
up for
basically.
that part of the field. So it was
I don't know
just,
how long
you
I
know,
lived there,
kind of a
probably
surprise to
just
see
a little under a year, and I got an
these
apartment in town,
test
and
plots and these
met my
monsters,
ex-wife,
you know,
and
they
got
really
married.
do tell the story versus just walking the field.
Then we
So
moved to
get a
North
hold
Platte,
of
Nebraska.
Dwayne ASAP and get the Coos
Then I
Mall
went to
Court
Des
Hybrids
Moines.
booked for next year and take advantage of some
Shortly
really
after we
good
moved
cash
there, she said,
discounts
"I don't
yet.
wanna be married
Yep,
anymore."
absolutely.
Oh,
Get a hold of
that's
them
tough.
and get an order put together. And
Well, she wanted to have a kid,
January
and I said,
ready,
let's
and
wait, you just
John's
moved here
busy
for her job.
treating, grading,
She
and
was a lab
bagging down
tech,
at
so
Warren, and it's
she was
not
working
going to be
at
long,
Mercy
and
Hospital.
we're going to have
Just
Brent
got
and
the job.
myself heading for Dwayne's, you know,
She
that
said, "I wanna have a
mid-March
baby right now."
area, it'll come fast.
Wait
Thanks,
here.
Roy. We're Hardy,
Didn't wanna
the
leave.
territory sales manager with Coos Mall Seed.
All right. Well, we're going to get back to the AM Minnesota program, talk a bit about the flu this morning here on AM Minnesota. Again, Susan Prieve is with me this morning. She's our guest, and I didn't get your background, Susan. Now, you're obviously a nurse. You administered a shot to me, and I fully trusted you are fully qualified to do that. Right?
Absolutely, absolutely. I'm a nursing graduate at Gustavus Adolphus College.
Wow.
And I started my career at Mayo Clinic in Rochester, and I got a few years under my belt there in surgical oncology. And then I was fortunate to start work with my career at Rice County shortly after that. My family's here, and I've worked at Rice County since 1989.
Wow. So you have been in the saddle a while here.
Yep, this isn't my first rodeo.
No.
No.
And I'm telling you, folks, I'm not making this up. I did not even feel the shot.
You were very brave. You're a good patient. You did really well.
Well, I mean, seriously, I didn't feel the shot, and I even watched you do it, right?
You did. You watched everything, so that was good.
I mean, I know quite often they tell you to look away, but I don't look away typically.
No,
When they give blood too, they say if you want to look away, you can look away. Why do I want to look away?
Yeah.
I'm curious as to how you get that needle in there.
Yeah, sometimes, you know, even the little ones that we give shots to are pretty curious too, and as long as they have their parent there to comfort them, they do quite well. So
We should probably establish what the flu is exactly. Influenza.
exactly, it's a great question. Influenza is a respiratory viral illness. It's caused by a virus that attacks the nose, the throat, and the lungs. It can make you very, very sick. It's not like a cold in that you can't push through and go to work and get your things done. This can lay you down and give you extreme fatigue, fever, make you so weak that you may not, remember for our elderly, they may not get their medications taken, they may not be able to prepare their meals. It really can knock a person down. It often can lead to hospitalization, and in severe instances can lead to death.
In fact, that can happen in even younger people than we imagine.
Yes, our most vulnerable with influenza are going to be our young children, pregnant women, and our elderly, and those that may be affected by other chronic illnesses such as diabetes, asthma. Those are the folks that we really need to pay attention to. We want to pay attention to everyone, but really need to protect those populations that can have real severe symptoms with the flu.
Ultimately, on both my parents' death certificates, complications from the flu is listed as the cause of death.
I'm so sorry to hear that. And we do know that in this year, when we do have some more, just more aggressive strains, that it may take an antiviral, and it's important to let your doctor know if you're starting to have febrile illness, particularly this time of year when we know that there's a likely correlation that it's going to be influenza. Because if with early intervention and an antiviral, we can keep that severity down a little bit, and that helps.
Well, I have to knock on some wood here. That's fake wood. I don't know if that works. Does it work to knock on fake wood?
Works for me.
In any event, I got to knock on some wood here. I haven't even had a lot of colds the last few years, and there's a couple reasons I think for that.
That you haven't had a cold?
I drink lots of water now. I think that helps. I have orange juice every morning. I think that helps. Don't you think that's
certainly remaining strong and taking care of yourself so that your immune system does not become weakened. You're spot on. That's one of the things we can do to help protect ourselves from illness. Viruses, even in the best of situations, can still affect us if your body can't recognize it. If it's mutated and your body hasn't seen it before, it's going to have a tough time fighting it. And you may need to use some extra methods like an antiviral to be able to handle that.
And I consciously try to take a longer time to wash my hands.
You just probably hit the best single way to prevent influenza, and we can go through those. I think that's one of the most important things we can cover.
Because, people touching doorknobs, all that stuff, right?
Exactly. You want to wash your hands frequently. If you're sick, you stay at home. If your child's sick, don't send them to school. Frequent hand washing the whole year through, flu or not flu, is going to protect you from so many different illnesses. So that's the key, number one public health concept, is hand washing. So, and if you don't have soap and water available, using an antiseptic gel. So you need to do that whenever possible. Antimicrobial gel.
If you're in the bathroom, the soap dispenser's out.
Yep,
Does
I hope you have one of those.
water still work?
Water and friction, but we probably want to use an antimicrobial gel as well. So it's always good to have one of those available. If you have one at your desk at work, have one available in your bag, your briefcase, whatever you have that available when you don't have soap and water. Soap and water is your first choice, but if not available, that's your next go-to.
All right. Well, that's good to know.
Absolutely. So hand washing, limit exposures, all of those things. Let your doctor know if you're starting to get sick, so you might need an antiviral. All those things you mentioned about staying healthy. Make sure you're trying to eat a balanced diet. Try to get sleep. Keep yourself healthy to be able to best fight off illness.
So you were saying something before we hit the airwaves I thought was very interesting, because I told you that I have friends who tell me all the time when I say, I'm going to get my flu shot, that they don't get a flu shot because last time they got a flu shot, they claimed they got really sick. And they think they got it from the flu shot. You said that's impossible. Isn't that what you said?
It is impossible. This is an inactivated virus that we are giving in the injection, so it cannot transmit the flu to you. However, I think the reason that people often think that, it takes 2 weeks to be effective. So let's pretend I gave you your shot today,
yep,
but you touched the person that hadn't washed their hands and touched your nose yesterday. You were exposed.
Right.
So if you did that even a week ago, and now you're going to get the flu now, and I gave you the shot this morning.
Correct.
It makes sense that you would think, doggone it, that shot just gave me the flu.
Because it's not, like you said earlier, it takes 2 weeks.
It takes 2 weeks.
It's not instantaneous.
And we're in peak season right now, so the possibility of you being exposed within the last week or so, and then my giving you your shot now, you could become ill tomorrow. You could become ill tomorrow. We need time for that vaccine to be effective. Also, after you receive the vaccine, when it starts to have your body make an immune response, it can give you some very mild aches and pains, and that can get confused with actually having the flu. What we do know is that the flu vaccine can make, and if you still get the flu after getting the vaccine, which is possible, we know that it can sometimes weaken and make it not as serious an illness as you would have had without the vaccine.
So do we know what strain is the most popular flu strain that's circulating now?
Right now, the one that's getting our attention is H3N2 and H1N1. The H1N1 that's in the flu vaccine this year has been modified to try and keep up with the changing virus. The H3N2 is an aggressive strain of the flu. The current flu vaccine, the one that you received today, has 4 different components to it, 4 different strains in it. And so we really are watching that H3N2. We know it was really difficult in a study that was done over in Australia, that we noticed that the vaccine there was looking at about a 10% efficacy, but we know that here in our country last year, when we really could see what happened with that match, it was more at, I believe, 34 to 30, 39% overall with the vaccine, 32% with H3N2. And we won't know exactly till the end of this flu season where we're at with the match, but it's probable that it would be somewhere in that same neighborhood as last year, unless the virus has mutated. Then it could potentially be lower.
Yeah, that sounds like a low percentage. Is that typical?
Usually on a good year, 40 to 60 overall for all the strains, you're going to have a higher efficacy rate for all strains combined rather than when you isolate separate strains. But it's never going to be at 100%. It's not ever going to be 100%. But we would like to be up more at that match in the 40 to 60. But viruses, as we've talked about, are a changing target, and they definitely, no matter what the match is, if you're one of those people in that 30% that didn't get the flu, that's important. And if it weakens the flu that you do get, that's equally important. And we're also trying to protect all those people that are at higher risk of death, hospitalization, or those that can't get the vaccine, period.
Yeah.
Our little ones that are under 6 months cannot get the vaccine. So the rest of us take care of them by getting our vaccine as grandparents, as parents, as caregivers, siblings. We can protect those that are immunosuppressed, can't get the vaccine, the little ones that aren't old enough to get the vaccine, and those that are going to have the most extreme symptoms if they get the flu.
Sounds like a hard thing to really measure. You know what I'm saying? The effectiveness of this vaccine.
Well, hard to know too, because not everybody goes. Everybody that gets the flu doesn't go in and get a swab and get a test and get reported. So
right.
It's really hard to know the exact numbers. But we do the best we can, and with research to get the best match that we possibly can.
Susan Prieve is with me from Rice County Public Health Nursing. We're talking about the flu, which in Minnesota is in the widespread category. And that's true here locally too, right?
The data that I have is that in Minnesota we are now in the widespread category. It's occurring throughout our state. Yeah.
Yeah, widespread. So it's a good idea to get that flu shot if you haven't received one yet. And you were telling me before we hit the airwaves, I said you have walk-in clinics every Tuesday. You said people can come in anytime now.
Yeah, we really want to get people vaccinated now to protect everyone as quickly as possible. We do have a walk-in clinic for anyone on Tuesday afternoons from 1 to 4, but I welcome you to come to our office. We're located in Faribault in the Government Services Building. For those of you that haven't stopped by Public Health, we'd love to have you. We're located, if you know where Godfather's Pizza is, we're directly across the street from there. You enter on the north side of the building, hang a right, and you're going to be in Public Health. And we'd be glad to have you come in. We have a large number of the high dose flu for those that are 65 and up. So please come in. Medicare covers that. We'll be happy to bill Medicare for you. All are welcome. We accept private payment for the high dose flu, and then we also have the quad that's available for anyone 65 and under and over age 6 months. We do need a parent with a child under the age of 18 to give consent for us to vaccinate the child.
You asked me before you pumped the vaccine into my arm if I was allergic to eggs.
I did.
Right?
A life-threatening allergy to eggs. Not a mild allergy to eggs, but life-threatening.
Well, you did say life-threatening, that's
yeah.
true. But if I am allergic to eggs, is there an alternative vaccine you can give me, or how does that work?
We wouldn't give you the flu vaccine if you had a life-threatening allergy, and by that I mean your airway closes down if you eat cake batter. If you eat cake that's been baked and you can tolerate that, you're going to be able to get the flu vaccine.
Oh.
It's a life-threatening allergy to all forms of eggs. Very rare. I have not had to withhold a vaccine because of life-threatening allergy to egg.
And what was the other thing you pointed out?
I asked you if you'd had a history of Guillain-Barré syndrome related to influenza vaccine, and I asked you about current illness and fever. It's not because that flu shot's going to harm you, but it won't give you the protection if your body's already actively fighting another illness. So I want you, when you're going to get that vaccine, to have it work as well as possible. A mild cold, we're going to go ahead and vaccinate.
Right. I was telling you I had a little scratchy throat this morning, and so I was curious as to whether that would
that was a great question.
throw me off, but it didn't. I got my shot. I'm looking forward to being covered here over the next few weeks. And if I get sick, folks, it wasn't because of the shot, because that's impossible, right?
It is impossible. It's inactivated.
Absolutely impossible. I printed off so many statistics here from the Minnesota Department of Health, you would not believe them. I have the sheets and sheets and sheets and sheets of charts here, and I always like to have more information than I need, which is definitely going to be the case here today. So stop on by and get yourself a shot, okay, folks? Because it's not too late. That's the main message we want to get out today.
Not too late at all. We do have people sometimes get stomach flu kind of confused with the influenza virus, and this is not the same as the stomach flu. That's a completely different virus. Again, for that, you also want to be doing good hand washing, and always have your children wash their hands before they eat, so to keep some of those viruses at bay. But this is not the same. This is a respiratory virus that we're talking about when we're talking about influenza.
Yep, wash your hands a lot. And you're cooking at home too, right?
Absolutely. Anytime you're in the kitchen, you're going to want to cook while you're cooking the food, before you serve the food, before you eat. If you're going to go to a restaurant and go out and eat, you're going to go to a buffet, every handle you touch, you're touching the one that somebody else did. So if you're going to go through a buffet line, wash your hands, get your tray, get your food, and then before you eat, go back and wash your hands.
They have these little,
or use your hand sanitizer.
I was just going to say, these little bottles of hand sanitizer. Whenever I go on an international trip, whenever I go on any trip, I make sure I put sanitizer in my bag.
Yep, definitely want to do that. So.
Because you just never know.
Yep, foodborne illness or just being passed from handle to handle, wherever, that is your number one best defense.
Last week, for statistics, according to the Minnesota Department of Health, there were 53 hospitalizations. I shouldn't say last week, the last week of 2017, the last week that's included on their statistics.
Yeah. Mm-hmm.
53 people were hospitalized. And to that date, January 4th, I think it says here, 375 total hospitalizations from influenza or the flu.
Yeah, definitely. Our at-risk populations, this can result in hospitalization for the reasons we talked about, extreme weakness, and all the other exacerbations that can come when you get knocked down with the flu and unable to adequately care for yourself, and then also the respiratory complications. Good example is going to be someone that's affected with asthma. They're going to need possibly some support to be able to get through the respiratory phase of the influenza virus.
So I think we covered the populations that are most at risk.
Mm-hmm.
You said pregnant women, people 65 and older, young children.
Correct, and those that have chronic health conditions such as asthma, diabetes.
You have a heart condition or something?
Yeah, we want them, they're going to be at higher risk with this vaccine to have more severe symptoms with that and may need more support, and they may need an antiviral.
Ran out of time. That's the first time that's happened.